another one that's vital for a lot of people to kind of learn. So I'm excited to dive into this conversation.
Yeah, definitely me too. So coming from the series of mental health, depression, and suicide, we're going now into breast cancer awareness. As we know, October is breast cancer as well as domestic violence awareness month. And so the first part of this month, we will be talking about breast cancer awareness, and the second part, domestic violence awareness. So definitely join us as we talk about these very, very serious topics in our community. So right now, we want you to go ahead and pick your phone up, get your devices, and we want you to share it. We want you to like it. We want you to comment. We want you to share with 50 of your friends, right, what we're talking about here today. Because we have professionals in the house. We have 2 oncologists as well as an overcomer, a survivor of breast cancer, and we will be talking today about this very issue. But first, before we go on, I want to give honor to where honor is due. And that is the visionaries of this show, and that is the senior pastor, physician, Dr. Lincoln Coffey, as well as assistant pastor, First Lady April Coffey. Thank you so much for your leadership and for your vision of a show in this church, in the community, where real people talk about real issues. So we know you're watching, Pastor and First Lady. Again, thank you so much. I'm ready to dig in.
Yes, yes, yes. Ready to start.
Yes. So let me introduce our guest that we have with us this week. Immediately to my right, she's absolutely beautiful. And so thank you so much, Dr. Stella Amici, for joining us here today.
Thank you, Ms. Carrie Ann. My name is Stella Amici. I've been a practicing oncologist for about 8 years now, but been out of med school 14 years. Oh my God, I'm dating myself.
And you look like you just graduated high school. I hear an accent. Where are you from?
Originally from Nigeria.
From Nigeria. Wonderful. You know, this church just launched a mission in Nigeria.
Really?
I think that's another topic that we have to talk to you about.
Please do. I'm excited to hear.
And we have with us an overcomer, a survivor. She is not a newbie to the show. You've been on here before, but not in this capacity. And so we're so thrilled for you to join us, Minister Katrina Richardson, and for you to tell us your story of breast cancer.
I'm honored to be here with you all, Pastor and First Lady as well. Honored to be here, and just honored to be sitting amongst you all. So I'm just ready to do this because it's so much to be said. And so many, how can you say, misconceptions about breast cancer and who can have it and who can't have it.
Yeah.
This is awesome.
Awesome.
Yes.
Well, thank you so much. We know we're going to get a lot of nuggets.
Oh, yes.
We're going to get a lot of nuggets from you. Thank you. And then we have also with us here Dr. Sharonda Henderson. Thank you so much again in pink. You know, I love pink.
Thank you. Thank you for having me. It's a great honor to be here with you. I am also a practicing oncologist. I've been an oncologist for about 12 years now. And I'm originally from Dallas, Texas, if you can hear my accent, huh?
Oh, you're a Texan. Okay.
Dallas.
Yes. And so I'm excited to help spread some information and knowledge to the community and hope that we'll be able to touch even one person.
Amen.
Yes.
Amen. Well, again, thank you so much. Again, as you see, we have some practitioners here with us. And so breast cancer is something that's very serious, and it really touches our community,
Yes.
particularly when we talk about African American and breast cancer as well. So Dr. Amici or Dr. Henderson, from either one of you, what does that, when we talk about breast cancer, what are we talking about first and foremost?
Well, I could kind of break it down with cancer in general. So all of our cells in our body are made to live and die a certain amount of time. We know as we're young and growing up, we grow fast. You see babies and toddlers grow really fast because their cells are designed to grow, divide, and die at a programmed rate. But what happens with cancer cancer cells do not die off like they're supposed to, and they just continue to grow and grow to a point where they've reached what's called a tumor, or sometimes you'll hear the word mass, or sometimes you'll hear the word lesion. All those things are the same. And so when a tumor cell develops, it doesn't do the normal things it's supposed to do as that type of cell, and it ends up invading or growing into other areas and affecting normal tissue. And so when a cell or a tumor cell grows to a normal tissue, it can cause pain, or it can cause an abnormality that you see on imaging. And that's how usually cancer is found, sometimes on imaging, or when some people will have symptoms such as the pain, or unfortunately if it happens to the bone or a break or something like that. So when cancer is diagnosed, that's why we have to get a biopsy, get a sample of that tumor. And as you look at those cells, as pathologists look at the cell under the microscope, they're able to differentiate a normal cell versus a cancerous cell.
Man,
Wow.
it's real.
So I know that you detected your cancer.
Yes, I actually went in for my annual mammogram. I received the letter in the mail, like, everything was good. There was nothing amiss, but I started doing self-exams at home maybe about a year prior. I don't know what made me start doing it, but I started doing them. And one of the things that I found, the best place to do your exam is in the shower, where, you can feel anything that's abnormal. And when I detected it, I went back after I had the mammogram, and they were like, oh, no, it's nothing. We didn't see anything. I asked for a disc. Still didn't see anything on the disc, but I knew something was there. And after much prodding, it began to grow in the right breast, and it didn't only grow down, but it started to lift. The blessing was that it never hit the lymphatic ducts, because once it hits your lymphatic system, cancer can go wherever it wants to go in your body.
Right. So let's slow down a little bit. You said that you started to do the breast check. So you had not been doing your checks before?
No, because I had 2 exams prior, and each one of them came back that they were normal. But it was just something different about this one, because it started like as a little piece of fatty tissue, and you feel it, and it's so tiny that you think, oh, it's nothing. But the more I did the check, the more I noticed that it was changing in size. So that was the first prompt. So that's what made me go back to ask them, can you all do a recheck on me? They kept telling me, oh, it's nothing. And I kept saying, God, it's something. Once I had it in my mind, and I pressed, and I would tell anyone, if you feel anything amiss, go get it checked, because from what I was told, it is normal for African American women to have what they call very dense breast tissue. So it might feel like a mass, but it's not a mass. But this thing, and I call it a thing because it was illegal in my body, began to grow. And so after much prodding, that's when they did what they call, what is it? It's a mammogram, but it's an ultrasound, and they did it stat. So basically, I went in on February the 19th for the mammogram and the ultrasound. They seen where they said it was blood supply going to the mass. And that's what gave them unction that this wasn't normal.
Wow.
So that's why we do recommend doing your own self-breast exam.
Yes,
So it's
ma'am.
not really for you to use it as a screening protocol. It's more for women to be aware of their body.
Yes.
So when you're always doing it, then when something feels weird, you're able to pick it up. Yes, our breasts majority of African Americans do have dense breasts.
So when you say dense breast, what does that mean? For the viewer out there that is, maybe a novice or unfamiliar or uneducated as to what all of this means, what does that mean, dense breast?
So a female's breast has lobes and ducts in it. So the ducts are I usually use a picture to show my patients. So ducts are usually like a line in the breast area. And then right at the tip of the ducts, you have like little lobules in it. So that what happens is most women, you can feel those, they are more prominent. It might be little tiny dots, but they're prominent in the breast. So when you're feeling your breast, you notice them a little bit more. Not even if you don't have a huge breast. It doesn't matter the size of your breast. It's just the way it feels. So sometimes when they do a mammogram, they will tell you the breast is dense because there's a lot of those little
dots.
nodules. Yeah.
And you said that's predominantly for African American?
It is in most women, but African Americans tend to have the higher rate of the dense breast. Yes.
Wow. Wow.
And
Okay.
dense breasts can also be seen in women that are premenopausal.
Exactly.
So because if you're a childbearing age, your ducts are meant to make milk, right?
Right.
If you're having babies, so those ducts are going to be more pronounced too. And so sometimes it's harder to, like you were saying, see something on mammogram when you have those dense breasts. When you're postmenopausal, those ducts kind of thin out a little bit, and your breast tissue gets a little fattier, and then that's what the term is less dense means too.
Wow. Wow. So what would some of those misconceptions, because I'm listening to your story, and so the first thing is you have to be aware of your body by doing the checks. So that's step number one, and getting your mammograms. And so definitely, step number one, breast checks are essential. When should someone start checking their breasts? Because I know of individuals who start at 40s or their 30s. When is it recommended for breast checks to start? Can we be saying breasts on TV like this?
Yes. We have to be direct. We have to be direct.
It's like saying arm.
Just like arm or foot.
It's part of the body.
Right.
It's part of the body. So when is the recommended age, right?
So I would say for self-breast exams, that starts when you develop breasts. I mean,
Oh, wow.
we know that breast cancer is more commonly diagnosed in older women, but it's not unheard of for breast cancer to develop in women that are really young, so
That's
in their
what I'm-
20s or so. And so being aware of your body and recognizing when something is abnormal, that's going to be the most important of that part. But screening, when we're talking about looking with mammograms, there are certain guidelines that are set, and right now the guidelines are 40, right? And starting at the age of 40. But if you have family history or if you've had abnormal breast exams before, then that age range can change.
Okay. What about individuals who have assistance?
The implants.
Implants.
Okay.
I like that one.
Yeah, I was.
Assistance.
Enhancements.
Enhancements. Is that something, because it is becoming the norm, right, to have enhancements, and so is that something that they should also be aware of?
Yes, definitely.
If they still have the breast tissue in, they should. Like for myself, I had to do a double mastectomy, and it was not pushed upon me, but it was, what is the word?
It was recommended.
Highly recommended, because I carried the Brca trait when they found out after doing the genetics of it. So this thing had been in my body for years. It was just waiting for a time to detonate.
So we need to break that down for laymen out there who don't understand all the terminology that you are so familiar with now. So when you talk about did you say bracketry?
Brca.
The BRAC.
That's-
So what is the BRAC? What does that mean?
So Brca is letting me know that it is something within my line. It has
It's genetic.
Yes.
Okay.
So it had to be in my DNA already, something that was there, and it was just lying dormant.
Okay.
So
It's-
in a
go ahead.
medical term.
Medical.
So BRCA is a gene that we all have.
Okay.
The goal of BRCA is to repair any bad stuff trying to come up. So it's supposed to be the one that cuts down cancer if it can. But the unfortunate thing is the ones that have the BRCA gene are the ones, it's not that their gene has a mutation in it. So that's what that means. That normal gene that we are all supposed to have 2 copies of, you have that one, unfortunately, that is mutated. So it's not doing its job. So if a cancer abnormal cell is forming up, there's no BRCA that was supposed to fix it. So now the cancer gets the chance to act up.
Okay.
Does that make sense?
So how does someone get their BRCA identified? Is that through coming through an oncologist, or how your regular PCM?
So we don't usually check it.
Okay.
Unless you came in with a family history. So if you have someone that has a family history of ovarian cancer, peritoneal cancer, so all those other forms of
So
cancer.
any form of cancer.
No, there are specific ones.
Okay.
especially ovarian. So that's usually in a primary family, so immediate family member. That's usually a hint like something might be wrong. You have someone that has breast cancer pretty young. Those are the ones that you also worry about. But the standards have come now that if you come to me with breast cancer, we are doing genetic screenings now, which was not usually the norm before. So when we're doing your screening, the goal is to find out if you have things like BRCA, among others. So with that screening, unfortunately with hers, she was found to have BRCA. So that's how that because we know. So I know we kind of went a little too far, but we know that breast cancer risk for some people, for the average risk, is about 12% over a lifetime period. But somebody with BRCA, their risk is almost 50%.
Wow.
Yeah.
So that's why it's important for us to find out. So when you show up, we want to know if you have BRCA, not just because of that particular cancer that you have right now. It's just to know what is your risk for the next breast and what is the risk for the other types of cancer, like ovarian.
And that was
So
the
that's why we
biggest.
recommend the bilateral mastectomy because of that risk for the other breast.
All right.
Yeah.
And when we say bilateral mastectomy, you're talking about removing the tissue from both breasts.
Well, mine was everything. Tissue, breast, nipples, everything had to go
Okay.
because of that trait. So they had to basically start over from scratch with me.
Can I add something on
Yes.
the end of the BRCA gene? Because we know that it is genetic and spreads through the family, it is very important not only knowing about your own body, but knowing your family history.
Yeah.
So many people, and we know within our culture sometimes, and I'm going to say sometimes,
Sometimes.
within our culture, especially in the older generations, it was those things you didn't talk
You didn't,
about,
yeah.
right? You didn't talk a lot about what happened to great-grandfather and things like that because a lot of things were misunderstood about cancers and illnesses. And of course, we know historically with distrust within the medical community and things like
Yes.
that, there are a lot of complicating factors that can go throughout our culture. But it's really important to know your family history, because if someone say knew that their mom or their aunt had the breast cancer gene or had breast cancer when they were in their 30s, then that is going to prompt their primary care doctor or some other physician to say, hey, you may be at higher risk, so you may need to get mammograms sooner, or you may need to get tested. So your primary care doctors can refer you to specialists such as geneticists for testing. It's a blood test that can be done. There are breast cancer, high-risk breast cancer specialists that are out there. These are doctors that focus and have specializations in identifying patients that are at higher risk for breast cancer, and they can follow these patients longitudinally too and be able to find cancer earlier than what it would be
Yeah.
found sooner.
Wow.
Yeah.
Wow.
I just wanted to add some insight on this topic of the importance of like early detection and the cases that fall out of the norm. I do have a family member where she was diagnosed with breast cancer in her early teens. She's now in her late 20s. She has had to experience 2 double mastectomies in that process, but just what you said, like her mom had passed away of breast cancer. So knowing that history, there was early detection, and it literally saved her life along this journey. So I just want to kind of highlight, I know we're talking about age 40, and a lot of times when we think
Yes.
about this and our detection and starting to do self exams, we think about being older at that point, but it can happen younger, and just being aware of your medical history in general is really important, and it could save your life. So I just wanted to kind of highlight that, and thank you for
Awesome.
bringing attention to that.
Yeah.
You know, like Carrie Ann was saying, what is the misconception? That is
That's
one of the
one.
Yeah.
misconceptions. Oh, it's a cancer of the older people. No, it's not.
Yes.
I do have a good amount of 20-year-olds and 30-year-olds with breast cancer. It's not the norm. It's not the common. It's still common among older people. But unfortunately, you're having a lot of younger patients with it. Like Sharonda was saying, knowing your family history. If you do know your family
That's good.
history, then we can start early. That will be the person, high risk can start early and maybe catch it at an earlier stage, a stage 1, rather than you coming with a stage 4 breast cancer. So it's a disease of women. No, it's not. 1 in 100, it's like 100 times more in female, but it's still a male. It's still a disease that you can see in a male. So there's all those different things, especially for our community. We hide it. We think we need to hide cancer. No, it's best for you to bring it out there so somebody can help you out before it's more advanced, and then we're talking, more aggressive procedures or treatments that could have been avoided.
Yeah.
Yes.
How do you begin a conversation with a young girl who is just beginning to develop? How does for that individual watching out there who may have a 13 or 14 or even 15-year-old who is beginning to grow breast? Well, actually, they grow them now at like 8 and 9. I'm okay, 8 and 9. How do you even begin that conversation?
I have a 10-year-old who I'm hoping that they're not breast. I'm hoping they're just still baby fat, but I know they're not. I think the first thing is to express to your daughters that having breasts are normal. It shouldn't be a shameful thing. It is part of growing up. It is part of being a woman. And as our breasts grow and develop, it is important for you to know your body and be safe with your body and be secure with your body, but also know the importance of knowing what's normal too. And so the earlier that you start have those conversations, and women and little young girls being comfortable with their bodies and comfortable speaking to you about it too, because I think that's the other thing. I want my daughter to be able to come to me and talk to me about anything. And so having those discussions earlier, sooner than later, I think is going to be important. So I would say 14, 15, it's probably too late. When like you were saying, they started earlier. So we want to go ahead and have those conversations sooner the better.
Okay. So what I'm hearing is, first and foremost, create a safe space for your child to be able to communicate with you about anything, and then communicate with them that it's normal to have breasts, number one, and then the need for safety in their health, in checking for
Self-exams,
in terms of doing those self-exams as well. I want to go back to you, Minister Katrina, on finding out. So you've been doing your checks now. You said you started for about a year. Is this something that you were reared in? Like we talk about starting with young adults, checking their breasts. Were you as a child told to check your breasts or anything like that?
No. Let's give you a little background. I am from Fort Worth, Texas. I am from Stop 6 Eastwood. Hello, family. Yes. And for some people, like she said, it's culture. So that's not one of the things that I was aware of. Literally, I was paying insurance out of my payroll every 2 weeks. That's something we do, right? And I communicated what I felt as, I'm just going through something. It'll be okay, because when you're from like grandparents and whatnot raise you, you don't go to the doctor for every little thing. That's something you don't do. And and it was just a lack of education. But when it got to me that something was in me and this thing was affecting me, it was like, no, this is what I'm paying for. I need to utilize this tool called, healthcare. And I'm working in a hospital. I'm working,
So you're in the medical field.
I'm in the medical field. I'm working as a medical support assistant, helping other people when they come in, fill out paperwork, documentation, working in the lab, no less. In the lab with the pathologists and so forth. And I had all these different tools available to me, but because of lack of knowledge, I didn't know what to ask. It was basically, I'm at work and I'm feeling it. And this young lady who's the supervisor of the lab, she sees me and asks me to come in her office and ask me what's going on. She said, I've noticed you doing X, Y, and Z for, excuse me. I've noticed you've touched yourself here and there. What's going on? And I explained it to her. She said, you need to get with your provider now and request a stat ultrasound and mammogram now. She said, I've given this warning to 3 other people. She said, and the difference between you and them is that you're still living.
Oh.
That scared me. And I'm not, as you know, I'm not one that's easily fearful, but that scared me.
Yeah.
So I immediately got on the phone, contacted my provider. Without seeing me, she just heard me. And she knew she knew me because her office was in the building next door to us. Immediately, the next thing that came through the lab was that ultrasound. And it was like on the 19th of February, I went in for the mammogram and ultrasound. They saw something there. They decided it is going to take a biopsy for us to see. We can't tell you if it's malignant or benign with just this. The 21st of February, they did the biopsy. That was the first time in my life I ever knew that I was up under a microscope for real. You know, somebody really seeing me. Friday, the 22nd of February, I got the call that it is cancer. We can't tell you what stage, but it is cancer. She said, do you want to talk to me about it? I said, no, and I hung up the phone. Because at this point, I'm in panic, and the only way for me to stay calm is to do what I know to do. It's normal. And I'm like, she said, she called back, what are you doing? I'm going into Walmart, and I'm going to talk to you later. And I hung up the phone
You said
again.
you went into Walmart.
And Walmart.
Okay.
I was just going, I had to go somewhere.
Right.
I had to get, for lack of a better word, at that point I knew my life was on the line.
Yeah.
At that point, I'm 46 years old. I just purchased a home. I just bought a new car. And I did all of this without a husband. Hello, somebody. And now you're telling me cancer gets to come to my house, and I'm starting to question the God that I say I serve, right? How could this happen? I'm doing everything you tell me to do. Oh yeah, it was real.
Yeah.
And so that's all I knew to do. She was like, can you sit down? I was like, no ma'am, I'm going in the store now. I'll talk to you later. And I disconnected the call yet the third time. It was like, she's
So
like,
she called you 3 times.
yes, like it was like she knew that it was too much for me, but she was still trying to be a comfort, if that makes sense.
Yeah.
And at that point, I was like, I'm rejecting her. It was like trying to find, a place of normalcy. I'm going in the store. Let's just walk around. Let's look at the pretty colors. I don't want to hear anything she has to say. But had I not taken the time to come to myself and listen, I could be sitting 6 feet on the ground today.
Yeah.
Because I kept asking, what stage is it? What stage is it? And they never told me until after everything was said and done. And I thank God for the oncologist that I had the privilege to be up under for Scott and White. And I understood why now. Because you're looking at the stage, you're trying to see a number, you're trying to see where you're at. The only thing they need you to do is keep your disposition and joy. Because he said, that's what helped me. He said, you always came in with a positive attitude. You always were happy. He said, sometimes your attitude helps you. And I came in with joy all the time. When they finally told me it was after the chemo, it was after radiation was done, he said, we can now tell you, you were at stage 3C. He said, you were walking into stage 4.
Wow. Wow.
And I didn't understand it. I would come in here at Open Fire and I would just serve. They would be like, Minister, you can. I'd be like, please, just let me do it. Just let me serve.
Yeah.
Because I just wanted to stay. I wanted to stay normal. I didn't want to be looked at as the person with the infirmity or the illness, or as the leper, as they would say in the Bible. I didn't want to be seen as the one who had something that needed to be pushed outside of the camp. Because at that point, I was on survival instincts only. And I'm thankful that I'm still here. I was on survival mode the whole time.
Yeah.
And nobody would have ever known it, but I was.
Well, we are thankful that you're still here, Minister Katrina, and you have, and I have seen you through that period, and I can say that you have kept that same spirit of joy, dancing.
Yes.
Even when you lost your head, you're still smiling, and so when we come back, we're going to talk about the attitude of the process. The healing process and what treatment looks like. If you're joining us now, we've been talking about breast cancer awareness, and we're talking with Dr. Sharonda Henderson, Dr. Stella Amici, as well as our overcomer, our very own survivor, Minister Katrina Richardson, and my co-host is Dr. Elizabeth Jennings, our Minister Carrie Ann Zamore. We will be right back after we take a brief message from a few of our sponsors for this show. Again, we're talking about breast cancer. Don't go anywhere. We'll be right back.
play Prodigal is coming to Austin's Grant Worship Center November 13th. Audiences are saying this hilariously funny and dramatic stage play is a must-see. Starring Will Molion as the prodigal.
You know, I am what I am. They don't see me as a valuable person. They just judge me or dismiss me.
And Brasco as the elder brother.
To save the world. If he could, he'd give everything for free.
And Austin's own Donald Harrell as the father.
He was the one that walked away and lost all our money.
I didn't realize we lost money.
Experience mind-blowing, sensational songs from powerhouse Tamara Champion.
He wants you, yes.
And the voice finalist, Rose Short.
Thank you, Father. Thank you, Lord. And
Doors open at 3 p.m. The show starts at 4 p.m. Get your tickets today at eventbrite.com and kzamore.com. That's eventbrite.com and kzamore.com.
arms wide open, the Father's waiting to receive.
And thank you so much for joining us on Overcomers Talk. We're talking today with physicians as well as an overcomer. Our subject is breast cancer awareness. And again, thank you so much for joining us. If you are just joining us, please share this. We're talking about the importance of doing your breast self-checks as well as following up with your physicians. We're joined with two professionals here, our oncologist, Dr. Sharonda Henderson, as well as Dr. Stella Amici, and Minister Katrina, an overcomer, a survivor of breast cancer. Before we left, Minister Katrina, you were sharing with us the process of learning, right? Of learning that your diagnosis was breast cancer.
Yes.
So after the denial, I take it that you went through all stages of grief.
I did. I went through the denial. I went through the anger. I went through shock. The why me.
Yeah.
You go through all of it, and then you say, okay, you have to make a decision. Or do I want to die like this, or am I living through this thing? What am I going to do to change the odds?
Yeah.
And I had to change diet because we learned a lot about what we eat and what we take in could affect you. I had to start walking and exercising, stuff that they tell you to do anyway for your health, because one of the things I know is that we should be walking, we should be doing stuff to keep ourselves healthy, but as you get older, you become a little lax sometimes. Well, when your life is on the line, you change all of that. I learned to like salads a lot. I learned to like fresh fruit and fresh vegetables. I learned to like chicken and fish and turkey and leaf pork.
Leave
and
red
beef alone. I learned there was a lot of little stuff that I didn't know that I could do that could change the trajectory of what I was in you know what I mean? The whole dynamic of what I was in. And like I said, for lack of knowledge, not uneducated in that point, because I had not been around this mountain before, so I had no understanding.
Of it.
None.
So you gave us several nuggets about what you can change about the process, change about your lifestyle. But before we go about changing the lifestyle, because I'm sure the doctors listening to your story,
Yes,
this is the story of so many women.
Yes.
Of so many women and men that have experienced breast cancer that I'm sure you've had to give. Do you give the news or you give the news to them? So tell me, what is that like when we talk about telling someone this is what it is? You know, what is that process like, and then what is the next step?
So Carrie Ann, to put number to what you were saying about so many women, the diagnosis of breast cancer in a year can be up to 280,000, just the U.S. alone.
Wow. So what percentage is that when we're looking at it? Is it broken down by socioeconomics, by race or ethnicity, or anything like that?
So it's still a higher percentage for white women.
Okay.
I think when you put it in percentage, I think for them it's like 24% per 100,000, 24 per 100,000. Sorry. 122 per 100,000, and then is 120 for an African American woman per 100,000. So when you kind of put it in those numbers. So, but the thing though is, even though it's more found in an Caucasian female, unfortunately our African American ones are the ones that are coming in more advanced stages. So yes, it's more common there, but they come early, they get diagnosed early, they get early breast cancer, get treated, and they're out. But a majority of our females are coming in high advanced stages. And
why is that though?
That's that whole thing about culture, like we were saying, or sometimes just lack of availability of care.
Yeah.
Okay. So lack of resources, culture, lack of access to resources as well?
Exactly.
Because I would imagine insurance. You have to have insurance to pay for a PCM so that you can follow up. So lack of access, lack of resources, lack of knowledge.
Exactly.
That was my biggest key. I didn't know.
Yeah.
I had no, this is not something that we spoke about. We didn't even, growing up, I don't remember discussing a lot about doctor's appointments unless we had to go, or dental appointment unless we had to go. And this is as transparent as I can be.
Yeah.
I don't recall those things.
Yeah. Yeah. Wow.
But I was paying for, out of my income, I'm paying for a healthcare provider. I'm paying for insurance.
But if you're not really sick, you're not going to the doctor either.
There you go.
Dr. Henderson?
One thing I do want to applaud you on is your persistence in saying something is wrong, that you recognize something was wrong in your body. One thing we do have to remember to be our own self-advocate, because there can be instances where, because you are young, we may say, oh, this is probably dense breast or something else. It may not be on the radar, because you are young and you probably don't fit the typical what's read in the textbooks. So being your self-advocate is going to be very important, and I recommend that for all women, especially us African American women, because again, historically we know that we do have higher rates of not only infant mortality but also higher rates of having diagnosed later stage cancers, breast cancer, prostate cancer. All these types of things are results of socioeconomics, but also the historical mistreatment and issues with our healthcare system too.
Yeah, yeah. Dr. Henderson, you see all types of cancers. I know we're focusing on breast cancer today, but it is so critical for our audience out there, and we have audience throughout the United States, the Caribbean, as well as some parts of Africa and England. It's so critical to know your body from what you're saying, that when something feels different, right, that it's important to follow up and be that advocate, because it may not be breast cancer, but it might be something else. Right. Like you mentioned ovarian cancer as well, and there was another cancer. You said that they're related when it comes to the BRCA. Which one is that?
Pancreatic cancer.
Pancreatic
yeah.
cancer as well.
And prostate cancer.
And prostate cancer. And I know earlier this year we did speak to some men about prostate cancer and the importance of getting a colonoscopy, because that is something that individuals, tend to shy away from. And I know our topic today is breast cancer, but when we talk about health in itself, it is critical just to know your body and get those self-checks and follow up with your PCM, and definitely practice self-care by eating the right foods, getting enough exercise and rest, and reducing stress
Exactly.
as well.
Yes.
Exactly.
So,
Exactly.
Yeah, I wanted to chime in and ask a question to the doctors. As far as mindset goes, I know we're talking about the practical things to do in order to address it, but if you don't have the right mindset to either care about your health, or if there's possibly underlying fear that you might be experiencing of the unknown, then sometimes we do nothing, right? And so I guess I just wanted to ask, what kind of advice would you give the audience who may be in that predicament where they haven't regularly sought checkups and they're at a point and they're immobile, right? What mindset or what suggestions might help them to go set up that appointment to be able to get that first check for themselves?
First, I would just say, know that there is no shame and no judgment in all of this. This is about you and your body, and you only have one.
Yeah.
It's only one of you, and that one of you should be the most important thing to you. So, being a self-advocate, being one that is going to push for getting the necessary care that you need is going to be the most important, I would say. Again, be open with your family and friends, be open with your children, to normalize healthcare, normalize taking care of yourself, normalize going to the doctors when you're not having pain or not having symptoms, because many times with cancer, when you start to develop symptoms, it's already pretty advanced. So you want to be able to catch these things early.
Yeah. Thank you.
So for a patient that gets diagnosed, unfortunately, you get the answer, yes, you have an abnormal mammogram. I just want them to understand that it's not the end of the world. Come up, let's do what needs to be done. Okay. If they need to send you to a medical oncologist, come on. Then your doc can talk to you, help you with the staging like you were wanting to answer. So once you know your staging, or because different things has to be done, we have to let you know if you're in an early stage, sometimes you just go straight to surgery. Unfortunately, if the cancer is bigger, it's still not the end of the world. We might need to do chemo before you go to surgery just to shrink it a little bit to get a better outcome. And after you're done with surgery, somebody's following you. So you're not alone. Most cancer centers have what we call nurse navigators. So they're usually that little person that kind of guides you through the process. There's counseling in some cancer centers. Not a lot of them have psychiatry, which I wish it is, but unfortunately there's not a lot available. But even if we don't have a psychologist or a psychiatrist, there are counselors there that are willing to hear you out or just be there for you. I always tell my patients, I know I can't feel what you feel, but my goal is to be there with you with each process. You might not have all the questions for me right now. If you go home, you remember, thank God for electronic medical records. You can send me a message, and maybe by the time you come again, we can talk about it. So don't let fear prevent you from getting the best care that you can as early as you can. Then we talk about mindset. I feel that takes you a long way. I had 2 patients with pancreatic cancer, and I always remember them. One already had that doom sense. Yes, I know pancreatic cancer is a bad cancer, but she already had that doom sense that anything I did, she still had her mindset that she's going to die. Compared to another one that came there happy like you were, and they were diagnosed the same week. I lost the one with the doom sense in less than 3 months, compared to the one that, yes, it's not that she's not being realistic, because they both have a bad cancer, but I feel like your spirit takes you a long way.
Yes.
Whatever you believe in, it doesn't have to be a Christian, but whatever, you have to have something that keeps you going. It might be a kid or a family member, something that wakes you up to make you think, I have to keep going for the next day, whatever the treatment protocol might be for you.
Yeah.
And so the mindset is very, very important in that. And I know you talked about that your faith
Yes.
is what kept you going.
Yes. If I couldn't have multiple conversations with God, whether I was angry, I was happy, I had to seek Him. And like Dr. Amici, am I saying it right? I mean, you have to be anchored. You can't, if you're out there just tossed, it doesn't matter what the doctors say, you see doom at the end. But I was grateful when I said I had all of my open fire family, my mom, my grandmother who since moved on since then, but I had strong women, strong foundation that kept me. I mean, because I literally got to one point of going through chemo and I was like, I'm done. I don't want to do it because they were telling me I had to go 5 days a week. And then the doctor and I made a compromise. How are you going to compromise with somebody going to save your life? But I asked him, I said, can I do it maybe 3 days a week instead of 5? He said, if you're willing to sit here for a few hours, because to me, having to be there so much, it would be like an abnormality. It would take my spirit. It would diminish it. It really would have. But I would go in for a few hours a day, and I would leave, and I was better. And I knew, in my mind, I'm getting better. I would speak it to myself. And I was on the strongest form of chemo. They call it the Red Devil.
Yes,
It's very. I hate it too. I hate it too. I called it the Red Angel. That's what I called it. But it was so aggressive because the cancer was that aggressive. By the time they got to the mastectomy part of it, I was at 5.3 centimeters that they had measured in size and width.
So it had shrunk to that size, meaning that it was larger.
It started at that size. Then it shrunk with the chemo. So I was then thinking I was good. I got to ring the bell. I got to break the bell. Amen. Hallelujah. No. She says, now you get to do radiation. Excuse me? It just shrunk. It's not even there. You can't even detect it. We understand. But because of the size that it began at, had you came in sooner, when you felt it, no matter what they said, had I went sooner, I probably would have had a chance and I wouldn't have been having to do the radiation. But because it was so large, I had to do the radiation regardless. It was a strong recommendation.
All right. So you just gave us a whole lot medical
I
terminology.
apologize.
So I want to go to the doctors to explain now the difference between your chemo and then the radiation.
So chemotherapy, think of it as strong medicine that's given in your vein. That's the most common way that we do chemotherapy.
It's like in an IV bag.
Yeah, that's the most common way. But there are certain, not to delve off into other things, but there are certain other drugs called targeted therapy and those types of things that treat cancer also, but just not given through the vein. But this type that you're discussing is given through the vein. And I use the analogy a lot with my patients to describe what chemotherapy does. Think of your body as a garden, okay? And the cancer is the big weed that's popping up in your garden. Okay, you want to pull the weed out, but that weed has already produced some pollen around there. Pollen you can't see. So because it was such a big weed, like your 5 centimeters, it may have given some little pollen around there. And so it's just going to be more weeds that pop up over time. We just can't see them right now. But the chemotherapy is the weed killer. So you're spreading the chemotherapy across the whole garden. And so as the chemotherapy is killing the big weed, it's going to kill the smaller little weeds or pollens that you can't see. And so that's how chemotherapy works. As it's given through your vein, it circulates throughout your entire body through your bloodstream. So where the cancer is located that we see on the mammogram or the CAT scan, it's meant to kill that cancer, but also the cells that we can't see. And so that's how chemotherapy works. And radiation uses high beam x-rays. So if you think of how you get a chest x-ray are smaller beam x-rays, and it's going through your body to produce a picture. But with radiation, these are very targeted high x-rays, and so these kill cancer cells also in the way that they divide, and they're going to aim those x-rays directly to where the cancer was located. And so although the cancer was removed or it shrank away with chemotherapy, the goal of radiation is to prevent the cancer from coming back right there where it was. So you're getting extra treatment on top of the chemotherapy that you had.
Oh, I love your analogies. I'm sorry. I love it. I apologize.
All right, awesome, awesome. So somebody out there who might say, I've seen someone who has had chemotherapy and to me it just made them sicker. Oh, I don't want to go through chemo because it was such a bad experience that I have seen, and I just don't want to be sick, or chemo actually makes you die faster. Those are some of the myths and some of the misconceptions that has been said. What would you, a physician, say to someone out there who may be feeling this way?
Okay. So one thing I want people to know is different cancers happen different ways and they respond. The treatment is different. So there are different things about cancer. If we start, you will not be finished for a month.
Yeah.
So I want them to know that your story is going to be different from the next person's story, because you don't even know if it is breast cancer. There are different forms of breast cancer. There are things that we look at when we find out you have breast cancer. So we're looking at different things. So treatment is totally going to be different. Now, let's say you are worried about the side effect, which is the main thing people complain about, is nausea and vomiting. So like Sharonda was saying, it is a weed killer, but unfortunately some of the good cells could be killed because it works on things that are growing fast. So that's why some people lose hair, because our hair follicles grow faster. So because it's doing that, unfortunately, some of the chemotherapy will cause hair loss. Some, not all. So that's why I tell people different cancers are different. Things that you could worry about, the nausea and the vomiting. We have gotten so much better with the pre-medications that we give patients now that wasn't available before. So before, somebody that had the red devil, like she said, would have been probably be laying on the floor with nausea and vomiting. But we've gotten so much better that I have patients that don't even vomit throughout the period. They might have the nausea, but the emesis, the vomiting doesn't happen because they have nausea meds at home to be proactive about. The day of chemo, we give them some good stuff that makes some patients feel better that day. They might not feel as good the next day, but at least they don't have all that bad side effects. So don't use somebody else's story as your reason not to get care, because yours might even just be that you need only a pill. And that is some breast cancers that are treated with just an anti-hormonal therapy. So please don't get care, and have your doctors help you make that decision.
Yeah. I'm hearing the importance through Minister Katrina's story and what you just said of really establishing a partnership with your doctor.
Yes.
I think a lot of reasons why some people don't go is because I don't want someone to tell me or make me, but I like the fact that I heard that you were able to like compromise on how you received some of your treatment, and there was, you know, a give and take on both ends. So it became a partnership. And I think that's just really important when we think about empowering each other about, you know, how do you handle care, is to look at it that way. And so I really love the way you shared that and indicated that. So thank you.
Definitely, definitely. And you've been sharing so many nuggets here that I just wanted to repeat, because one of the things that I heard earlier on is breast cancer is something that needs to be discussed as early as your child beginning developing. And so first and foremost, encourage a trust and relationship with your child, so that your child is able to talk to you about their body. Normalize what breasts are and the growing breast, as well as self-care. So those are some of the important things, and then continue to check yourself. And have a relationship with your PCM, like you said, and then definitely be an advocate. Be an advocate, be an advocate. If you feel something different, definitely be an advocate. Now, what are some ways, I don't know if breast cancer is something that can be prevented, but what are some ways, what are some practical steps an individual can do to ensure a healthier lifestyle
where they can perhaps, I don't know if you can prevent breast cancer?
So, just as you stated, as the ways that you went about in helping you get through your treatment and have a successful outcome, those are the same things that you can do to potentially prevent breast cancer or any chronic illness. Diet and exercise is important. Decreasing the amount of processed foods in your diet.
So we're going to take that slow. Diet and exercise, decrease processed food. So we're talking about canned foods,
anything with a package, chips, honey buns, anything that's not growing out of the earth.
Honey buns?
Right, my breakdown.
Okay, so canned food. So you want to substitute your canned corn for fresh corn.
Anything that comes out of the ground.
Canned greens, fresh greens.
Yes.
So essentially have fresh vegetables, fresh fruits instead of canned items.
And if fresh is not an option for you, because we all know sometimes things can get left in the refrigerator frozen. Probably going to be the next best for you before going to the can.
Okay, so that was going to be my next question. What about, because we do recognize that we have people who live in food desert areas where they don't necessarily have access to fresh vegetations on a regular basis. So frozen would be then another choice. So if you can't get it fresh, then at least your frozen vegetables, frozen fruits, you can get that in your HEB, your Publix, Kroger's, Piggly Wiggly. You just go to the frozen section and you can get all of that there as well. I've lived in different states. Can you tell?
She said Piggly Wiggly.
Yes. I haven't seen that in so long.
Giants Foods, wherever it is you live. Giants and Safeway. Anderson's, all of those different places. Go to your frozen food produce. But by all means, make sure that you are trying to avoid as much as possible your processed food, your processed meats, your corned beef, your spam, your potted meat. Stay away from all of those things as well. Because again, there's some things that are cultural, right? Those comfort foods are very cultural, but they're not necessarily the best for you. I heard you say pork.
Yes, that was one of the strong, because I love my bacon. Hallelujah. I do. But my doctor at the time told me, he said, you can have it, but have it in measure. You can't eat a lot of it. He said, I would prefer you to eat none of it.
Yeah.
Sodas and canned sodas, like I love Coca-Cola. No, you stop. Lots of sweets, your cookies, your cakes, your pies. Oh my, because we're going into Thanksgiving, right? Everything is within reason.
Moderation.
Moderation.
So everything that you do it in moderation.
Yes.
So definitely watch what you're eating. Watch what you're eating. We're not saying that it will prevent cancer, but it will definitely reduce the risk, as well as if you are already sick, it will definitely help in your healing process because you need those healthy and natural foods back into your body. Exercise, whatever you can do, just don't be sedentary. That means get up and move. Walk somewhere, do something. Go for a walk. I know Dr. Liz loves to exercise. Follow her on Facebook.
Yes,
Join
she
her exercise. But definitely get moving. So one of the things that we know about breast cancer, again, as our physicians here said today, although the population that it affects the most is Caucasian women, we know that a large percentage of African American women, and this is our demographic that generally watch our show, are also affected by breast cancer, and by the time you are diagnosed, it is in a more advanced stage. So we would strongly encourage you to do your breast check. We're going into Breast Cancer Awareness Month. Please follow the websites, cancer.org. What are the other websites?
So, American Cancer Society has their cancer.org.
So cancer.org.
Other ones, the breastcanceralliance.org.
Breastcanceralliance.org.
And things for young people, there is a Young Survivors Coalition. That's usually the ones that have been through breast cancer, because it doesn't really stop there. Your life has changed.
Right.
So it's good to have something like that as a support system to know what the norm is and know how to live outside of that. But especially cancer.org, I think that's a good website to dive into.
Awesome, awesome. So cancer.org, make sure that you are doing your breast check. On cancer.org, it will give you different directions on how to do your breast check. When you make your doctor's appointment, talk to your doctor. Take an extra 2 or 3 minutes to talk to your doctor about the proper ways to do your breast exam. Again, do them in the shower, do them when you're laying down in bed, when you get up, after you get out the shower, before you get dressed. Please, by all means, make sure you are doing your breast exams, at least on a daily basis. Talk to your physician if you notice anything is different in your body. Any final words from our physicians to the community about breast cancer awareness?
So first, I would say just highlight importance, as you were saying, of having the relationship not only yourself but also with your physician too. We are not here to dictate health. We want to be partners in your health with you. We present the information to you, and ultimately we work together to provide the best outcomes for you. Also, if you are unsure and don't have a good relationship with your physician, don't take that as a way of just trying to ignore the issue, because it won't make it go away. If you have to find a physician that you have a better relationship with, then that's what you need to do also. And always take a family member with you. It's important to have a different set of ears, because as you were stating, when you hear that diagnosis, it is a scary thing. And the first 5 to 10 minutes after you hear the word cancer, you probably have shut down, and you're going through all the emotions and thoughts of what could happen, and so you don't really hear a lot of the information. So I would say always bring a family member with you to those appointments.
Bring a family member.
And if you go to a doctor and you felt like you didn't have that relationship with that doctor, you are okay to have a second opinion. Don't apologize for it. Feel free to hear from someone else, so that at the end of the day, you know that you're making the decision that works for you.
Yeah.
Awesome, awesome. Dr. Stella, Dr. Henderson, thank you so much for being here today. We really appreciate you.
Thank you for having us.
Thank you very much. Again, breast cancer awareness is this October. Next week, we'll be having our panel discussion. We're going to continue to talk women's health, women's issues. Again, thank you so much for joining us on Overcomers, where real people talk about real issues. We'll see you next week.
Thank you.
Thank you.
Bye.
Bye.